Okay, so this is one of my favorite before and afters because I feel not only did the body change to like wowza, but it seems like the energy changed. Can you tell us a little bit more about what we did for this patient?
First of all, this patient is one of the most compliant patients we have. I mean, she follows all the directions the right way and doesn't skimp. If we say, let's do these 17 different things, she does these 17 different things. First was hormone optimization. Mm-hmm. That was the biggest thing we did with her in the beginning. Then we got growth hormone on board and started to enhance those levels because growth hormone goes down as we get older. We then placed dermal filler. As you get older, men and women both lose about 10 to 15 cc's of volume in their face from fat loss, bone loss, muscle loss. That's equivalent to a tablespoon. Okay. And we replaced that amount of filler in our face. We also did PDO threads. PDO threads are a type of suture material that's been around for decades. We used it in OR when I was a urologist for decades. And this suture will dissolve slowly over time, and it's placed underneath the skin, so you can't see it. But it is engineered in a way that the skin will help pull up the skin and to tighten it. And so I know a lot of people have this fear for them, but it's a painless procedure the way we do it. Yeah. So she got that done. Okay. She also is doing various other peptides that we offer, and she did some body sculpting, which we use TruSculpt in our office, not CoolSculpt. CoolSculpt is painful. It leaves what we call a shark bite. It leaves numbness. TruSculpt uses heat energy, and it heats the fat cells to where they die, and the fat is then absorbed by the body. It gets rid of about 20% of the fat in a targeted area, and it's perfect for that woman and man who has a problem area, like a muffin top or a little pooch or inner thigh fat that they want to get rid of. Mm-hmm. Wonderful way to body sculpt. So she underwent a few treatments of that, and those results that you're showing are great progression of her over time. Same bathing suit, same pose. Yeah. I mean, you can't beat that.
I know.
And I mean, and look how much better she looks. Oh, she feels so much better.
Oh, that's good to hear. So you mentioned the body sculpting thing. So I know, like for myself too, like the lower belly, I don't care how many reverse crunches I can do. It's maddening. What's a good option for that?
We have two devices that would address that. Mm-hmm. One is called AccuFit, and this is an electromagnetic pulse type device that stimulates your muscles. You can get the equivalent of 70,000 crunches in 30 minutes.
Wow.
70,000. Yeah, that's how many times it can pulse, and that is significant. Yeah. So you do that a few times a week or once a week to different parts of your body. We can do it to the belly. We can do it to the thighs. We can do it to the buttocks. Mm-hmm. Just a wonderful device. And then we can couple that with TruSculpt, which is our heat process to kill fat cells rather than freezing them, which is painful, and that's what CoolSculpting does. TruSculpt uses heat, much more comfortable, no side effects, no downtime. Fat's permanently destroyed, about 20% per treatment, and it just offers just the right amount of sculpting that both men and women are really happy about.
Great. And I know there's a lot of like these trending weight loss drugs out there. What are your thoughts does someone need to be doing hormones too first, combination?
The first thing they need to do is their habits. Proper eating, proper diet, proper exercise, proper amounts of sleep. That's the key. Yeah. Hormone optimization plays a big role because if you don't have muscle mass, and women would lose all their testosterone when they go through menopause and really cannot put on muscle. Yeah. Muscle's going to burn fat 24/7, so you need to do that. But then when it comes to these new medications like Ozempic or tirzepatide, I think they're very, very safe. They are very effective. People lose sensitivity to insulin as we get older, and carbohydrates. Then just you have two choices with carbohydrates. You can either burn them or store them as fat. And these medications definitely help us avoid that. And we have seen significant weight loss. Now we tell people the goal is not 40 pounds in a month.
Right.
That's not healthy, but we do it in a healthy way. And we've seen people over the course of 18 months take 100 pounds off.
Yeah, great.
One of our employees.
Yeah, I know her.
Yeah.
So we do get a lot of questions about what is regenerative medicine. I myself have had knee surgery, multiple of them, and I've done, stuff here that's helped. Can you talk a little bit more about what your offerings are?
Sure. Regenerative medicine is sort of like platelet-rich plasma. Platelet-rich plasma has growth factors that help regenerate and repair tissue. Well, there are cells in the body that will help regenerate, and some people will call them stem cells, but we don't call them that at our practice. These are human cells and tissue products that come from Morton's jelly and the placenta of mothers who have given birth to live babies, and so these are just products of conception, and these products contain enormous numbers of cells and messengers that will go into the body to help repair and regenerate. So these are very, very potent. Wherever you place them, you're going to see improvement. Whether you're putting it in the skin, in lines and wrinkles, you're putting it in a joint for that kind of repair. Mm-hmm. I mean, it's been phenomenal what we've seen. I'll tell you one of my stories. I partially tore my rotator cuff, my right rotator cuff, and I broke my upper humerus, the upper part of it. And I went to see the orthopedic surgeon. He said, George, I would normally operate tomorrow, but you've got that fracture. I need to let it heal because of all the inflammation. So I'm not going to be doing anything for 6 weeks. I went, what? 6 weeks? Oh. I go, well, can my nurse practitioner place platelet-rich plasma and these regenerative cells in my shoulder? Mm-hmm. And he said, sure. I don't know if it's going to help. I mean, it's not going to hurt anything. Sure. So she did it, and we did it several times because this is my working arm. And the day before surgery, I had to meet with him again. He examines me, takes more, X-rays and images, and comes back into the room and said, George, I've canceled your surgery. I went, what? And he goes, no, you're healing so well. I want you to keep doing what you're doing.
Wow.
So we did another month of treatments, came back to see him, did that stuff again with the imaging and exam, comes back in the room, said, you're clear. You're
Powerful.
clear.
So for, let's say if someone has an issue with a joint or back pain, things like that, would they start with orthopedist? What would be a good game plan there?
Unfortunately, too many of the orthopedic practices are governed by what insurance will carry, right. And insurance won't carry most of these things that we're talking about.
That work.
So they're not able to offer anything to the patient. We can do that, though. We're able to offer the stuff. We're able to offer these different services. Mm-hmm. There are different peptides that help with immunity and repair. I think people have heard about BPC-157 and TB-500. These are peptides that we all had in our bodies when we were younger, and as we get older, they just start being made nearly as well as they were when we were younger. And so, right. These are natural types of products that our body used to make, and we're able to offer that to patients, whereas more traditional or insurance-based practices are not able to do that because it's not covered by insurance.
Right. We hear that all too much, I think, of not being able to choose what's right for the patient because it's kind of limited by insurance.
Yeah.
Great. What have been the most powerful transformations you've seen with some of those regenerative cell treatments?
Oh, the me being able to use my shoulder without having to undergo planned surgery was pretty spectacular. We've had people a fraternity brother whose wife has had bad hips from a very young age, and they would drive 5 hours to come see us, or they still do that. They come 5 hours. She told me that if she was in a car for more than 90 minutes, she'd barely be able to walk. Well, we put some of those regenerative cell products in her hips, both hips, one visit. They drive the 5.5 hours back to the beach. She gets out of the car. Normally, she says she'd just lay down on the couch for the rest of the day.
Oh, gosh.
She gets out of the car and decorates their entire house, not just one room, but the entire house for Christmas. She said it was amazing. This was 3 years ago.
Wow.
3 years ago. She says her hips still don't hurt.
Oh, wow.
Yeah.
That's really powerful.
Yeah.
Great.
It doesn't last that long for everybody, but for her, it's wonderful.
Perfect. So I've had a couple of people ask me if you've had a facelift. What's your answer to that?
No, I have not had a facelift. Absolutely, positively not. I use our skincare products. I'm a guy, and that was not an easy thing to start to do, but one of my estheticians years ago said, Dr. Abraham, you do everything in this office, and the patients like that because they know that you've undergone it, you know what it feels like yourself, how comfortable it is or uncomfortable. But one thing you don't do are the skincare products. And I said, well, that's because I'm a guy. She goes, that's no excuse. And I started using our skincare products, the prescription products that we have, as well as our physician grade. And then I do microneedling. We have a very good microneedling device called the Genius RF radio frequency, and it's microneedling that couples radio frequency along with it, and you get wonderful stimulation of fibroblastin and elastin from your skin cells. So I do that. I do our laser resurfacing. Okay. I use our laser spot treatments for colors. I do PDO threads. I do neuromodulators. So basically, I've given away everything. I do everything that we do here, but it's short of surgery. Everything that we do has minimal to no downtime, very few of any risks because we're using natural products. And so, no, I've not had a facelift.
Yeah, your cheat code. I guess the joke, too, is almost, I don't think patients realize this, but typically rather than actually taking a lunch, Dr. Ibrahim will be receiving a treatment and eating during or very briefly to maximize all time of all of our treatments here.
You got to multitask.
Yeah. Great. What would you say is your most rewarding treatment to do? I know I love watching a YLIF patient walk out of the treatment room and constantly checking the mirror and hearing all of our oohs and ahs, but...
Well, so let me explain what YLIF is. YLIF is a method of putting dermal filler into the face, but rather than making tiny little needle sticks all over the face the way most dermal filler is placed, this is placed in a very precise way using cannulas for the most part. Cannulas they look like long needles, but they're blunt. And we pass them between a muscle layer and the bone that's sitting on top of that muscle. And that grasps the dermal filler much better, and so that it doesn't move. And since we're following the lines of that patient, the patient's not going to look different. I mean, we're following their own natural structures to begin with. Right. And when you put back the lost volume, the entire lost volume, which I said can be anywhere from 10 to 15, maybe even 20 milliliters or syringes of filler, you've got a beautiful result. And, it's instant. And to see the before and afters and see these women pick the mirror up and look at themselves, and we always hold their before picture beside their head. So when they're looking in the mirror, they see both before and after at the same time. And it's wild to see, the joy, the tears of joy. I mean, we've had plenty of people literally start crying. They were so happy from it. And we have men that do this. So that's important. Men, I've had it done. My lower face, I've had filler in my lower face. I've been doing that for years. Yeah.
Oh, gosh. I think some of my favorite before and afters are some of our male patients. And there's one in particular I remember who had sort of longer hair and was very casual dressed. And after the Y lift, he came back and we almost didn't recognize him because he had a fresh haircut, new outfit. And we're like, okay, this is...
Well, and I've had patients look at that before and after and go, now what's this, a father and a son? And that's the same guy. Yeah. Yeah, but he's just done with, basically the stuff that I said that I did.
Yeah. It's great. I don't know if you remember, but one of my best friends came in for the Y lift about 2 months ago, and she was trying so hard not to cry in the moment. And as soon as you left the room, she just completely lost it and was so thrilled. She'll send me now FaceTime. She'll always want to FaceTime me because she wants to constantly show off her jawline. And, she's younger too. She's in her mid-30s. So it's not just for people that are older. If you want a certain facial structure, it's pretty nice to see what we can achieve and how natural what you do is. So,
well, and I remember the medical assistant that moved, she's no longer here now, but when she was in her 20s, and we put filler basically in her chin. Yeah. And when she saw her profile, the first time she ever thought that she had a chin now. And I can remember the whole office bursting into tears.
Yeah, it was powerful. It's wild how much impact a chin has. And I don't think people realize the chin in the lower face in general, especially men. Yeah. I know when we had a lot of more people that were doing the Zoom meetings, a bunch of gentlemen were reaching out saying, hey, I just feel like I feel kind of soft was the word that I kept hearing. So a lot were doing the Y lifts, and I'm so glad the men were getting into the aesthetics because it was such a profound impact on them, on their confidence too.
Very much so. And one other thing to point out about the Y lift method, the filler tends to last much longer. Whereas most dermal fillers, you need to replace it every year. Right. With the Y lift, we're seeing people 4 and 5 years before they come back to get anything. And then when they do come back for more filler, it's oftentimes about half of what we placed originally.
Right,
Yeah.
right. I know sometimes we have a lot of people that are just educated on or have heard about Botox and
Okay.
the thought process that it can do it all. What is the sort of the reality of the situation?
No, Botox cannot do it all. There are three basic tenets to facial aesthetics. There is relaxation, so that's what Botox Dysport does. It relaxes muscle. So these muscles that cause lines and wrinkles can be treated with those neuromodulators. Then we need to do resurfacing. Resurfacing is where we're dealing with the layer of skin that you're actually looking at. And that resurfacing can be with the skincare products that we recommend, all the way to microneedling, to different lasers. So that's another method to help with the way somebody's aesthetics. So now we've got relaxation, we've got resurfacing, and then refill. Refill is where we place dermal filler. Traditionally, we use hyaluronic acid as our dermal filler, and we'll place that into the face to restore the volume that's been lost. So if you really want to look good,
Yeah.
you've got to do all three.
Okay.
You just can't come in and get Botox. It's not going to do anything for the saggy skin, because the skin is saggy because there's loss of volume in the face. So you need dermal fillers for that. And then what are you doing as far as your complexion? Are you doing the right skincare products? Are you getting microneedled with radio frequency to improve your pore sizes? So you got to put it all together.
Right.
Yeah.
And skincare.
Yeah.
Always.